Hey guys, welcome back to another episode of our podcast. And as always, we like to start off with a wee bit of a fun,
Interesting
cheeky
story.
story.
Yeah.
And you always have the stories, so
I have in my device. So today's fun story is titled "The World's Longest Hangover."
Ooh.
So this guy, poor guy, had a hangover that lasted for not one, not two, not three, 4 weeks.
4 weeks.
Weeks. Not even days, weeks. After he drank 60 pints of beer.
when?
Wow, here we go. So, 37-year-old man has had the world's longest known hangover after consuming 60 pints of beer. He had no history of health problems or head injury or take any regular medication, which I love the sort of history-taking aspect of this. It's like clinical
Very on
skills
brand.
Oscar, yeah. Doctors looked over him, he did a CT, they couldn't find anything, and in the end, he went to an eye specialist who determined that he'd simply drank far too much, which if I was told 60 pints of beer in a weekend, I would be like, cool. So he admitted he'd been drinking beer solidly for several days just before he began experiencing the 4-week-long headache and blurred vision spurred on by a domestic crisis. Fair enough. And it took a whole 6 months for the man to bid farewell to his lingering headache and hazy eyesight, with doctors administering him with long treatment of anticoagulation. Wow.
60 beers
Wow.
in a couple of days.
Wow.
That's crazy.
But
and
it
then,
said 6 months to get rid of all of the symptoms of the hangover. Could you imagine 6-month hangover?
That'd be crazy.
Think how bad you feel for a 1-day hangover.
Imagine, yeah, it's just 6
It
months
doesn't
of that,
end.
just not being able to do anything.
You can't
pretty
take a
much
little
properly,
cheeky paracetamol, you feel better in an hour or two, or hair of the dog, I'll just have another pint, and then you feel, no, it's just ongoing torture.
Yeah. I mean, 60 pints, though.
That's a lot.
It's like something was going to happen.
I know.
I did not expect a 6-month hangover, but you'd be like,
I kind of sort of do now.
something's going on. Now you're a bit like, 60.
Also, he'd be going to the bathroom constantly
Yeah.
for 60 pints. Someone's written in the comments, that's 34 litres in one sitting, impossible. Your bladder would be working overtime.
Yeah. Or how many days did it say?
It said several days. I'm going to assume it's not a binge weekend, but it's probably like
Like
maybe,
a week, maybe. Or like.
Probably like 5 days or so, like several days. Because
Yeah.
then it would have put like a week, but it's still within a day. So I'm thinking like 4 to 5 days. That's a
Crazy.
lot.
That is
Yeah.
crazy.
That's a lot of alcohol to consume.
Yeah. If, like, say 5 days, you're consuming still, like, what, like 12 pints a day?
Fudge.
Oh.
So, moral of the story is don't drink 60
pints.
pints. It did say he had like a family crisis or a personal crisis, so I'm sure there was a lot going on behind the scenes, but you know, other things to use to deal with difficult situations.
Yeah.
I
To
mean,
the people who may be close to that, I know a couple of people who.
You're
We're not
calling
going to throw
people out.
shade. We're not going to throw shade. Maybe you should watch out for the 6-month hangover.
Okay. Well, I have not been drinking for a while, and I'm scared that I'm going to have my first drink and I'm going to have a hangover that lasts for the length of time I've not been drinking. And I would be so put off. That is enough to put you off drinking. That, you know, head around the toilet and you're like, I'm going to stop drinking forever. If I had his experience, I probably would. That's it.
Yeah. So, a rough story.
It is.
I
But
didn't know it was possible, but the more you know.
exactly. Now I've learned something.
Yeah.
Anyway, into today's fabulous episode.
Yep. So we sort of last time sort of wrapped up on our series that we had going about the transition into uni and sort of that journey from before to like after,
Yeah.
making friends, that sort of thing.
Yeah.
And now we're sort of entering a new chapter, a new sort of branch that
new
we're going to
series.
explore. A new series. That is the word I was looking for.
New series.
Which is going to focus on study skills.
Study skills, sort of just learning at uni, just general tips, tricks, advice, stories, things like that. I think the format that we had for the other one for our like intro to uni worked well with that sort of storytelling and things like that. I think for study skills, they might be a bit shorter because it's more practical and hands-on.
Yeah.
And these series are going to last like throughout us obviously doing medicine, our degree and stuff like that. So, you know, if you're following along, they're going to be on a playlist on YouTube, and we'll just have it titled like Study Skills Playlist, and you can watch all the episodes that we put up that are related to this topic. If that's now or in a month or in a year's time, just keep coming back and checking in, because they might not be as like I don't know what the word is. They might not follow on from each other. We might have other topics thrown in there. But yeah, I think these are definitely going to be more practical, hands-on. We'll try and get a few more guests to kind of like explain things or talk to us about being like productivity and things like that.
A little bit of a focus on the academic side of uni. Which
of course.
I know some people are like, oh, academics, who cares?
But
that's like that's half of uni.
I mean, that's probably for a lot of people the big part of uni. So I think it's a good, probably just, you know, share our experiences, but also just kind of like look at, because I feel like there's so much online. There's so many influencers as well that are like, do this study technique to get great results and blah, blah, blah. And I feel like sometimes I look at them and I think, nah, that's bull, that's cap. I don't believe that that's actually an efficient way to study. Maybe not for me, but like some of the things I see, I'm like, I'm not convinced. So I think it could be fun for us to like dive into some of these things, maybe like hear from people and see like why they adopt these methods. And if anything works for you guys, glad that we can help in future.
So, as always, you can follow us on Instagram and TikTok, where we're gonna post shorts, post like forums for like Q&As. For the study skill blog, I think something good would be like personal tips, maybe personal things that work for you, or like things you've seen that work, instead of maybe the story time based thing that we were doing beforehand, because how many stories can you really get about studying? Exactly. But you can also catch the episodes on YouTube if you want to see our lovely faces, or Spotify and a podcast if you don't. If
you just want to hear us,
if you just want to hear our beautiful voices,
our beautiful voices. On that, talking about the story time change, I think I mentioned it to you before. I think I'm going to do a sort of Instagram, maybe TikTok, on finding great study spaces in and around campus and just in general. I've seen quite a lot of that, and I thought that looks quite fun. I'm a serial study in my room kind of gal, but I think I need to diversify, because it's not all my life I'm going to be in a bedroom in a student flat. So I feel like I need to adapt to my surroundings and be able to feel comfortable studying 100%. In different places.
So be sure to check that out when it comes out.
So once we get this series up and running, be sure to follow us on socials, like we said, so that you can see our reels where I will go around different places on campus or just anywhere in general and rate like the facilities for studying and like let you guys know how I find it. And also another thing, we have a highlight reel of this on our Instagram page already, but we actually need to just start doing is a day in a life of whatever we're doing. So I think we're going to have to start doing some like social media takeovers where one or the other of us, and we'll just go about share what our day-to-day is on our stories and just show you, like, you know, getting up in the morning, going to lectures, go to placement, because we're going to start placement soon as well, which is super exciting. Just to give you guys more of an insight as to like what our life is like at uni beyond just our wee catch-up chats.
Maybe try and get other people involved in that as well. Maybe see what people from other courses day in the life like, because it's obviously going to be quite different as well.
Exactly. So actually, if you are out there listening and you don't do medicine, you're at uni, at college, you're studying at the moment, and you'd like to showcase or share your uni journey experience so far, give us a shout and we could definitely have a chat about maybe doing something along the lines of a little social media takeover.
Or if you are one of our medical school friends and you want to do that as well, just let us know.
And we can share it all with you guys. Anyway, so should we jump into today's episode on study skills?
So I think for today we're just going to do like sort of branching, like overview, introduction. We're still going to do like a Q&A. I do have a couple questions. And after that we're going to do like a wee tips/advice section instead of the story time like we mentioned. I've got a couple of those from different people. And we're still going to be doing the hot seat though.
It is hot seat time again, and we have increased the time as well, so we'll tell you more about the format change a little bit later on. So stay tuned, make sure you keep watching. But
getting on to study skills. So you've obviously done a degree beforehand, and coming to the medical degree. What are your experience with study skills, maybe in your first degree,
Yeah.
comparing that to medicine? What worked the first time that maybe didn't work? What didn't work the first time that maybe works now?
Yeah.
So yeah, just let us know your journey.
So, wow, studying, honestly, first of all, I think it's this thing people just hear about studying, and it's like this one item. And what I figured out from doing chemistry, doing medicine, and just like growing up and, you know, developing what I feel comfortable with and stuff like that, is that it's this ever evolving entity in itself, right? Like, it's not just I'm going to study and you just sit and do one thing. It's different forums, different formats, different methods, depending on the subject you're doing, if you're with groups of people, how you interact with different people, and also where you get your content from for learning and studying. I've realized now that literally anything can be used as a tool to help me study. Okay, so when I was at school, very spoon-fed teaching done there. This is what is going to be in your exam sort of thing. This is, you're learning just to pass that sort of paper, GCSE A-level kind of thing. So I didn't really develop much of a study skill except memorize as much as possible. There wasn't much critical thinking or like problem solving and things like that, unless you did like maths, a bit of physics and stuff like that. But most of it was very much like rote learn, which has come in handy for medicine because a lot of people, if you do like biological sciences and things like that, it's very heavy on, you just need to know a lot of stuff. So I think I have good capacity for memorizing things and learning how to memorize, and I have different techniques on how I do that, but we can chat about that later on. But when I started doing chemistry, that was the biggest jump I've had from like educational levels, from learning at school to learning and studying at uni, because I wasn't just being spoon-fed information anymore. I had to go out and find information myself. And it was a big shock because I was thinking, oh, it's fine. What I get taught in the lecture, that's what I need to know. So I'll study that and then I'll get to the exam and it'll be fine. No, so much extra reading is involved. And for that, you need to enjoy what you're doing so that you're willing to go and read widely to pick up that information that your lecturer probably skipped on, maybe mentioned for 1 second and then passed on. You need to go and get that because that's going to be in your exam potentially. So that's one thing. And also it not being just about memorizing everything. I had to problem solve a lot. And when COVID hit, our exams were open book in a way. So it wasn't even like, it was online, it wasn't in person and like in a hall and you're writing your answers down. It was like, okay, we're going to be at home. We have internet access and stuff like that. The exam then became sort of problem solving exam, where it was like, given this situation, how would you maybe, you know, design a drug for this? Because I did like medicinal chemistry. And so I've been taught, oh, these kind of drugs are made for this and this kind of drug is made for this and blah, 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 blah. But now I'm having to like apply that knowledge and create something at the end of it to answer this question for like 12 marks. And you're like, whoa, that's a different skill set to just recall information.
Yeah.
So I think doing chemistry really helped my kind of critical thinking and analysis and being able to take information on board, process it, and then be able to reproduce it, not word for word, but apply it to a problem-solving situation. Now coming back to medicine, it feels like I'm going back to kind of school and that rote learning of lots of information in our preclinical years. I think once we get onto the wards, we're going to see people, we're going to see patients. They're not going to follow a textbook. You know, like there's going to be some cases that you're like, oh, pretty standard. But there's going to be a lot of things that are mix match, and you're going to have to think of your feet and be able to apply different things to a problem and solve it. So I think my studying has had to adapt to face the different types of learning I've had to do. And it's not just recall all the information, like memorize, and recall. It's been, you know, learn, practice papers, go to real life situations and try and adapt and learn it. Watching lots of TV shows that are relevant to the topic. I love watching TV shows, not because I think they're super accurate, but because it makes me think about the inaccuracies and process what actually could be the correct answer. So if I'm watching a medical drama and they're like, push 24 cc, blah, 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 then I'm like, I don't think you should do that. I think you're going to kill the patient if you do that. So things like that, like just different tools and techniques I've used. And I think now I've got to a place where I feel a bit more like confident in how I can study. So I'm studying smarter and not burning myself out for hours on end just studying to try and memorize everything. I can be a bit more like effective with my studying, I think. What about yourself? I thought it's quite a long-winded answer, but that's a journey of my studying.
No, I definitely echo that.
Yeah.
School was a lot of memory based, although like I was also quite like a STEM like student. Like I loved math, loved like the sciences, physics, chemistry.
Yeah.
I did computing science as well. So a lot of those were also like problem based. Like you knew the formulas. It would be like, oh, here's the scenario.
Yeah.
What formula is going to fit? How are you fitting it in?
Yeah.
Like utilizing it. And then when I did my 1 year of engineering, that was like heavy part of it. Like here's the scenario. You need to be able to know like what to utilize, like what bits of information to like pick out. And I feel like that's also transitioned in medicine quite well because although we are in our preclinical years and a lot of that is memorization, once we get past that, like our main job is to like take a patient history, pick out the bits of information that you're like, oh, that's not looking right. Oh, that's looking like this, and make a diagnosis, and then formulate a treatment plan from that, which fits the patient perfectly.
Yeah, definitely.
Like the best for them, and that is problem-solving skills, like critical thinking, that sort of thing, which does take time to develop. Yeah, but yeah, it's really like helped with the transition. And in terms of like study skills in general, I feel like we'll go into more detail about this specifically, but I'm a very visual learner. Like I love watching videos, making mind maps. There is still a bit of memorization currently with like our preclinical years, but like, all right, I'm just going to memorize from this lecture because like anything can come up. But yeah, I'm definitely a very visual learner. So like if I see it, even just like in post-it notes or something, and like a nice like poster, mind map, PowerPoints, videos, all of that pretty much helps me study better.
Fair.
But we will go into that because there's a whole like visual audio kinesthetic sort of triangle of learning. That we'll explore.
Could probably be its own video. There's so much research into them, but we can talk on
definitely
like,
explore that.
But yeah, sounds good actually.
Yeah.
What do you think has been like one thing of advice you've ever gotten, or like study technique or something that has really like elevated you? Not saying like right now, but like at a time where you were like, I can't do this, and then you did something and it just clicked and you did really well on that exam.
Just taking all the Q&A questions. That's fine. We can talk about it a bit later as well. For me, one thing that like people say, like it's always said to you, is like everybody is different. Everybody learns differently. So one thing might be working really well for somebody, but for you, you're like, I don't really like that. Like everybody here is obsessed with Anki, Anki. Anki's never got me, you know. I never got Anki. Got my back. Anki and me were not friends. But it's just knowing like that doesn't work for me. I'm gonna explore different options, and there's also that element of like different things, like different topics maybe
work better
with different study skills. Definitely. Like maybe like having like a visual mind map for that. Maybe this topic just needs like a textbook. Memorize it, do that. Maybe this topic I need to like get some like hands-on experience to be able to build my knowledge in that.
Physically take that in.
But it's just about like knowing what works for you, and if something that worked for someone else really well doesn't work for you, that's not an issue. I think it'd be good to maybe go into some of the questions that people have sent us in, and then I feel like, sorry if this turns into like it might turn into maybe just a bit of an advice column.
It
like,
is probably
questions in. We're like, oh, okay, this is what we think. This is what we think.
Yeah, I think if you guys have like personal, like individual, like you said at the start, questions, you know, if something actually has come up whilst you're studying, like, oh, this information that I've been taught just doesn't go into my head, how, like, what would you advise, blah blah blah, send them in and we can like have a chat and like give some more practical advice about that. And if we don't know, we will say so and we will get back to you in the next episode.
Or even just like post about it on Instagram. Yep. This is what we're thinking.
Cool. So
so there was a question obviously about like any advice you may have. There was one about how to sort of tackle or avoid procrastination.
Ooh.
Which I feel like, again, something we could probably just talk about for a while.
Yeah, I mean, I think we should do a productivity episode. Just
Yeah,
like
definitely.
how to become super productive.
But like just like a brief overview. I
how
guess.
to stop
just like very brief,
procrastination. As we procrastinate by doing this podcast instead of studying. For me, to stop procrastinating, the best thing I do is organize my time. So I am a big journal planner person. I love having my planners and calendars, and I write out my week in advance. So lots of people have like a whole year planner and month. You find what works for you. For me, it's looking at things week by week, because our course literally changes week by week. So I will say Sunday night, plan my week ahead. When I do that, I can see the blocks of time where I have free that I would just put like study, revision, or whatever. And that's when I know, like, say between 2 o'clock till 5 p.m. one day, I'm just revising. But it means that all the other time of that day, I could put in the things that I would probably do to procrastinate in that study block. So if it's cleaning, if it's going out with friends, if it's going to the shops, having lunch, dinner, all those kind of things, I schedule that in so that I know my 2 to 5 study block is 2 to 5 study block. And I also make sure I have my time in the evening. Like, I think quite a lot of people like will work until like 10, 11, 12 o'clock at night, whatever, studying. I'm quite strict about it being like, I finish at like 8 o'clock. That in my diary, it's evening routine, and that's have my dinner if I've not had it already, chill out, night skincare routine, maybe go for a walk as well, and like just zone out, watch TV, read book, like my chill out time, so that I know I have that to look forward to in the day. I don't need to spend all my days watching TV, scrolling, although sometimes I do, but like, you know, it varies. But like, do you know what I mean? Like, if you plan in advance, then you can see the structure of what you're meant to be doing, and then that kind of like motivates you to like get that done and tick it off, so that you can like relax whenever you want to.
Yeah. It's definitely like the big thing to tackle that is effective time management, planning your days out, getting a routine set, and that does take time, and I think it would be good to explore that in the future.
Yeah.
So yeah, if you want that, just let us know. We probably will end up doing it at some point.
Yeah, definitely.
Yeah. There was a question about specifically spaced repetition as a study technique.
Yes.
And like thoughts about it being good or not. I personally don't maybe do it, so cannot give advice on that.
I think this is where the flashcards get into their thing. They're like, yeah, this is what we do. I think they're quite handy. Like, when I've done flashcards before, it is really good to like have made them and then be able to read that information, take it on board, chunk it, and then come back to it, say in a week's time. But I think that's like, to me, everyone says spaced repetition like it's the easiest thing to do. I think it's quite like elite level time management, because you need to think about scheduling the time to make your notes, scheduling the time to come back to those notes again, scheduling time again to come back to it, on top of the new amounts of information that you're picking up along the way. So I think it's quite
there's a lot to it.
Yeah, you have to be very good at having like lots of different moving parts and fitting them into their schedule. So I don't know, like probably when I graduate I'll be like, I have mastered spaced repetition after 5 years of university.
And I think we'll wrap up with just one talking about sort of how to do effective note-taking during lectures, listening, or even like revision notes.
Yeah.
So what sort of note-taking do
I do?
Resources do you use? Is it effective? Like, how do you take notes?
I think, again, another whole episode we can do on effective note-taking. So we get our lectures, and first of all, iPad. Okay, probably every medical student has one or something similar, tablet. You could get your lecture notes, the presentation there, and then you can write over them, annotate over them. And I find that really helpful, because I like to have my notes on the page where the lecturer was talking about something, especially if there's a diagram to like refer to. When people have their like A4 page and they have like, oh, this is where I have my notes, and this is where I had like definitions and unknown words. I'm like, how do you remember all of that as you're going through the lecture? I wouldn't. So yeah, my page is very much this was the lecture slide, this is the notes I wrote on that, and then I go away and get a textbook, and I, like I said, use my ILOs. So I have my ILO for that lecture, answer it, use all the different notes I've picked up along that lecture, just compile it into sort of like a bullet point or like a short paragraph statement that kind of like tells a succinct summary of that topic. And then that's it really. I don't really do any fancy dancy, lots of colours or different things like that. I'm just pretty much straightforward.
Yeah.
What about you?
So I have like a way of doing it that works for me. I don't think it's effective, but like it's like what's like working for me, getting me through. So what I like to do is I'll obviously look at the PowerPoint if and then I like to transfer all that to a Word document. I like to go like super old school, go straight to the Word document, and then if like say it's a live lecture, what I'll do is I'll end up annotating like in the PowerPoint sometimes. Sort of switch between to either like a Word document or just annotating the PowerPoint itself.
Yeah.
And then sometimes what I like to do if I like want to like maybe like write on it, like write like revision notes, write like diagrams, stuff like that.
Yeah.
I will end up printing out the notes.
Okay.
And sort of like annotating it, and then I'll have that like revision material on me.
Yeah.
And it's not the most effective in the general sense, but it's what works, and that's what studying is about, and note taking. Whatever works for you is perfect.
Yeah. If it works and gets results, stick with it.
Yeah.
Also, like, don't be afraid to try things as well. Like, you might have one way of doing something and think, right, I passed my exams anyway, so I'm just going to stick to this, which is fine if that's all you need to do is pass. But don't be afraid to, like, add small changes to see if that's going to help you, like, incrementally improve your mark. You know, if you're print out your notes and write down and annotate and then do it all in a Word document, can you chunk that even further down to make little flashcards to help like come back, that kind of thing? Do you know what I mean? Like just small things to make little quizzes for yourself or something like that you can like just elevate your study. Like don't be afraid, don't get too stuck in a rut, because like I said, I think studying evolves, and how you need to study depends on so many other things. And if you get stuck in being a person that's like, I only study like this, when all the other things around you change and you need to change and adapt your studying and you don't, you're gonna fail, and you're gonna be like, oh, but I studied like this for years, how am I not getting my results? Because you've not learned to adapt your techniques. So yeah,
and I think now would be a good time to get some advice from other people. So I asked around the student room specifically about any.
You went to the student room and asked.
Yeah, I went to the student room and asked for any tips or advice about study skills. And first of all, from the Uni of Kent rep, like student rep, on the student room, his name is Dom, because he wrote Dom at the end.
Not me. I didn't sneakily type it. No, that's fine.
So he wrote, one of my favourite study tips would be to set many deadlines for yourself and pretend the final deadline is a few days before it is.
This guy wants like pressure on pressure.
Yeah. This gives you room for flexibility and time away from your work if you would like to read to again before submitting.
Okay.
Many deadlines help you stay on track and also allow you to feel a sense of accomplishment when you hit one. Setting many deadlines allows you not to stress before the deadline. Okay. Often at university, deadlines can clash, so this period can be a stressful time. So I think that might be useful for, say, coursework, where you're like, right, I'm going to try and write this paragraph within this date, and then I'm going to get this bit done within this date, and then like you're slowly working your way up instead of just being like, right, I'm going to get the whole thing done by this date.
Fair. I might try that actually, because
we've
got a bit of coursework that we have to do, and I've just been putting it off for the longest time ever, and now I'm like, I need to get it done.
Like I struggle because like I'm like I either want to write it all at once, or like I'm like I can't
I think I need to just do like I'm going to do this section and then this section. I like that.
Other tips were like studying in a quiet room or space, such as a library, maybe cafes as well, like Waterstone. Waterstones.
Exactly. I'm going to rate all the different study spots, so we'll get back to you on that one.
There is some from Chloe. There's another rep. Staying away from distractions, whether that means putting your phone in silent or studying alone. I know some people have like apps that can lock their phone. The location will really matter too. If you're looking to get quality focus time, perhaps the silent areas in the library will be a nice place to work. Again, she loves the deadlines as well. Set deadlines for yourself.
Everyone loves a deadline.
To-do lists, stuff like that. Take adequate breaks. While studying, it is important to take breaks and also socialize, still do the things you want to do, like go to the gym, do sports, all that.
I want to piggyback off the quiet space where you're studying. I really want to get these, I don't know if you've seen the Loop headphones. So they're meant to be like headphones you put in like earplugs kind of thing, where they kind of reduce the amount of external noise. and depending on which model you get, it can be like completely silent or it could be like slight ambient noise and stuff like that. And I think I really want to get one because
that's cool.
I love listening to music, but sometimes I feel like I can't focus whilst I'm listening to music. But if I don't have my headphones in, I feel like exposed to the environment that I'm in, that I'm like, oh, anyone could pop by and I'll just be distracted. So I've seen those. If anyone else has heard of them and has used them, let us know what you think of them. But
what we could do, and this poses a question if you want it,
yeah,
on our Instagram, we could set up a wee reel about study technique, resources, different gadgets or stuff that we could use for studying, and maybe we could rate them, see how they apply to us, pros, cons, stuff like that. Anything we'd recommend, put up and be like, here's where you can get it, like signpost to it.
Yeah, okay. That's going to be on our stories and stuff, and we could just kind of like keep you guys in the loop, no pun intended, of what works for us for studying. And if you guys have suggestions, definitely chuck them in, slide into our DMs and let us know things that work for you so we can share it with other people, because I think that's one of the things. You get to uni, everyone just goes off studying and you can feel a bit like, actually, how do I study, what do I do? So this could be a cool place for people to kind of like figure out something that could work for them. So
that's where it wraps up that wee segment. Again, if you have any questions or any advice yourself on how you study and what's effective for you, just put them in our Instagram and we'll
try our best to get back.
Yeah.
That sounds good. So, I've quite enjoyed that.
Yeah.
Okay, so now we're moving on to
the hot seat.
We need like a theme tune for hot seat, because I feel like it needs its own thing. Right, cool.
So we're going to switch things up a wee bit because we're like 30 seconds, maybe not long enough to do it. So we've sort of extended it now to a minute, and we're gonna continue to do it. We're gonna take turns. Any guests that we have on, I know on our last episode we had a guest, and we got them to do the hot seat. Any other guests that we ever get on, they will be doing the hot seat as well.
The leaderboard will be in full swing. It's already up. I think we're on like 2 or 3 each, so it was very close. Remember, at the end of our academic year, so in like end of June, we will do a forfeit challenge for whoever finishes last. Maybe a little mini prize for whoever finishes first, but like lowest score. And it's up to you guys listening, watching, to come up with what you would like our hot seat forfeit challenge to be for whoever's last. And we will get them, whoever it is, could be us or whoever, one of our guests, we will get them and make sure they do a challenge and film it and put it up on our stories or our Instagram page.
Yes, agrees to it. I mean, we're not going to force anyone.
Yeah. I mean, there's going to be a certain amount of peer pressure involved. No,
yeah, there might be peer pressure, but it's not going to be forced.
They're not going to be forced into anything they don't want to do. Don't worry. Yeah. So, anyway, moving on to our quiz. Have you got a timer up? Let's get a timer up. Moving it to a minute. Got a few questions here. Let's see how well Danielle can do. Are we adding our totals onto? Because I feel like that's a bit unfair.
No, maybe we should keep it like maybe single best, because we're getting guests in once.
Yeah.
So maybe we should try a single. We're gonna try a single best approach. Like, say one time you get 4, next time you get 5. We're only counting the 5.
Yeah. Okay. Cool. Are you ready?
Timer is ready.
Guys, if you're watching, try and do these along with us. See how many you get right, and if you want to share your answers with us,
just comment them down.
Yeah.
Right,
3, 2, 1, go. What is the average recommended time to start revising for an exam?
A month before.
Okay. Which study technique involves chunking study time and breaks in 25 minutes and 5 minutes on and off periods?
What was that called? I can't remember. Pass.
Which study method involves getting 80% of your results in 20% of your work?
What?
Which study method involves getting 80% of your results, or seeing results, from only 20% of the work you put in?
Pass.
Okay. Which study method involves returning to information after several time intervals?
That's your spaced repetition.
According to Glasgow Uni, how much extra time study each hour of content?
3 hours.
According to a survey, in how many hours do students spend studying?
A day.
Yeah. No, a week.
A week. 20 hours.
And I think
That's the same, yep.
perfect timing.
Oh,
I actually
God,
made the exact amount of questions, so that's good.
Oh God.
So how do you think you did?
Terrible.
How did you find those questions?
Terrible.
Really?
I mean, I couldn't remember like specific names.
Yeah. I thought
Because like I'd be like, oh yeah, I've heard of that one. I can't remember the name.
I was trying to keep it very study related.
I remember they're like, oh, study for this amount of time, take a wee break. I can't remember what it was called.
Yeah. Okay. No, so let's go through them. So what is the average recommended time to start revising for an exam? So I've seen online about 4 to 6 weeks. So you said a month, so that I'll give you the month for that.
Awesome.
4 to 6 weeks before the start, like the date of your exam, is apparently a really good time to like start your intense revision period. So for us, that's decent. That means Christmas is a great time to start. So I feel
so confident. Excuses for not starting
exactly. Which study technique involves chunking study time and breaks in 25 minutes on 5 minutes off periods? Can you remember it now? No. So you pass with this one. This was the Pomodoro technique.
Okay, I would not remember the name.
So it's like people said you could get like little egg timers. You can have like the ones on your phone, and you study for like 25 minutes or 20 minutes, and then you have a break for like 5 minutes or 10 minutes.
Yeah.
And you repeat that for like 4 times, and then on the 4th one you get like a slightly longer break. But it just means you have these like focused on-off sessions. But that's the Pomodoro technique.
Okay.
Which study method, I thought this was super easy, which study method involves getting 80% of your results from 20% of your work? So it's 80-20 principle, which I was like, bro, just like listen to the question again. So basically it's this concept, it's an 80-20 principle. I think other places do like 70-30. There's lots of different like ratio breakdowns, but it's basically like the whole study smart, not hard, where you like 20% of your work is going to yield 80% of your results. If that makes sense.
Yeah.
People apply it to like business and stuff like that. Like, you know, 20% of your business focus is giving you 80% of your company's profit or like income. It's like just making sure you put effective work into like one particular area, so like the greatest amount of results can come from that, so you have more time to do other things. So yeah, that's a handy one. Which study method involves returning to information, spaced repetition? According to Glasgow Uni, how many extra hours of study should you do for each contact hour you have? So I remember you said 3 hours.
Okay.
I remember when I started chemistry, they were like, for every hour we do contact, you should do an hour.
An hour, okay.
So it was like an hour. And I was like, that seems fair.
Okay, yeah, that seems fair.
So if you've got 20 contact hours, you should do 20 extra hours.
Okay, no, that seems fair, yeah.
Makes it a 40-hour week, which is a full-time working period, so that's kind of handy. According to a survey in England, how many hours do students spend on average studying per week?
What did I say?
You said 20 hours per week. It was 10 to 13 hours, according to the survey. So not quite, but you were being too nice to students, maybe us, but like maybe other subjects are like, well, we don't need to study as much. But yeah, so I think overall you got
like 2.
Spaced repetition, and yeah, when you start rising exam, 2 marks. Okay.
So anyway, I feel like that's a good place to wrap up this episode. So thank you guys for watching. Yeah. As always, you can follow us on Instagram, TikTok, catch the episodes on YouTube, Apple Podcasts, Spotify.
Mm-hmm. And make sure you get involved, answer our polls, questions, and if you want to reach out to us for anything, submit anything, Instagram is probably the best place to reach both of us.
If you just want advice, just pop us a message and we can give you the best advice we can.
Exactly. We'll try our very best. But everything stays anonymous, of course.
So thank you guys for watching, and we'll see you next time. Bye.
Bye.